Good afternoon, and thank you for joining us for this live conversation. Today, we're joined by pulmonologist Dr. Naveed Hasan and Sheelagh Stewart, a manager of the cancer program at Union Hospital, to discuss the importance of screenings. Specifically, we'll start with lung cancer, because according to the National Cancer Institute, Cecil County has one of Maryland's highest rates of lung cancer. Dozens of our family members, friends, and neighbors are diagnosed with the disease each year. And if you have any questions while we're live here talking about these screenings, please submit those questions in the comments below this video, and we will get to them throughout our conversation. Thank you both so much for being here today.
Thank you, Megan. Glad to be here.
Thank you.
And Sheelagh, let's start with you. You've been doing a lot of research on that statistic with the National Cancer Institute. Talk about that work and why it's so important.
Yeah, so thank you. As part of my work with the cancer program, we are working with the Commission on Cancer because we're an accredited program. And this year, the Commission on Cancer aligned with the American Cancer Society because there is a real concern about the lack of screening that has been occurring, particularly during the pandemic. And obviously, there's been a lot of focus on COVID and stopping people coming to the hospital and other areas for screening. But cancer doesn't stop even during COVID. And so when we've looked back and seen the rates around screening, there has been, as much of 80% reduction. And the NCI thinks that there may be as much as 10,000 deaths as a result of that. So when we look, as you stated, at Cecil County, which is the top county within the state of Maryland for lung cancer, we are particularly concerned with our lung cancer screening, which has dropped because we know that early detection saves lives. So we want to be able to get a focus to get our screening back on track.
Absolutely. And one of the main screenings we'll be talking about today is the low-dose CT scan. So talk about what that looks like.
So low-dose CT screening is where patients will come into the hospital. They will have a CT scan. It's a really quick and easy scan. They literally will lay down into the CT scan. There is a non-invasive procedure. It's really quick. They will come in and they will be done within 10 to 15 minutes time. So it's something that's so simple, and we really want to encourage the people to come in and get that screening done.
And Dr. Hasan, who qualifies for that screening?
So Megan, any individual who has smoked an equivalent of a pack a day for 30 years and are between the age of 55 and 74 years old and are current smokers, they qualify for lung cancer CT screening. Now, if you're a former smoker and it has been less than 15 years since you quit, you qualify for a lung cancer screening CT scan. I do want to encourage anyone outside of this criteria still talk to your family doctor, pulmonologist to check for any other lung-related diseases that you may have incurred from tobacco smoking.
And what do you say to someone who may be concerned about just getting a CT scan?
So the key word here that Sheelagh mentioned is low dose. So with any CT scan, people are concerned about radiation because there is otherwise no risk, like there's no needles, blood draws, anesthesia. So the radiation is for a cancer screening CT is much lower than a standard CT scan. So for easy understanding purposes, for a low dose, it is equivalent to about 5 chest x-rays, while standard CT scan goes to about 18 to 20 equivalent chest x-ray radiation. So the dose has been reduced to a lot lower levels. And as we get more and more modern CT scans, we tend to reduce the radiation every single time. So despite the cumulative radiation that one may incur over 20, 30 years of annual CT scans, the societies continue to recommend annual CT screening for high-risk individuals as the benefits do outweigh the risks.
And why are screening so important? As Sheelagh mentioned, many people have put a lot of that on hold, especially in the last 18 months or so during COVID. But why are we even having this conversation today? Why should people get screened for lung cancer?
Great question, Megan. So let's start with if lung cancer, unfortunately, is one of those cancers that you do not become symptomatic unless you're in advanced stage. For example, you get a skin cancer, you see something on your skin, you go to your doctor. You see a lump on your breast, or you feel a lump on your breast, you go to your doctor. Your family doctor may do a blood test and find anemia, and you get a colon cancer screening. But on the other hand, in lung cancer, most patients do not have any symptoms until it's late stage. So that's why it's very important in lung cancer, especially. Now, medical professions have been looking for lung cancer screening for decades, until in 2011, there was a breakthrough study that showed us that low-dose CT scan annually done in high-risk individuals actually reduces mortality. So we were very excited about it. So that's one thing. Now, I would like to share some data too. In 2018, CDC showed data that about 150,000 patients die of lung cancer annually in the United States. That is about 35% deaths of all cancer-related deaths in the United States. The second leading cause of cancer-related death is breast cancer. That is 20%. So together, lung cancer and breast cancer cause more than half of the cancer-related deaths in the United States. And so that's why it is very important. Now, if everyone who qualifies based on the criteria we earlier mentioned for a lung cancer screening, if all of those actually do get the screening, it is estimated that about 20,000 of these deaths could be avoided per year. And that one saved life could be your loved one or your family member. And that's why we are here talking about it. And
Absolutely.
let me add one more piece of data. So like we've talked about Cecil County. So I've been serving as cancer liaison physician for Commission of Cancer for past several years. And I look at the data every year for Cecil County. So our stage 4 lung cancer diagnosis actually exceed by 8 to 10% compared to the rest of the state of Maryland, which tells us again that we need to get these cancers to be diagnosed much earlier with the screening.
Absolutely. And we will talk more about lung cancer in this conversation and throughout the next coming weeks, as November is Lung Cancer Awareness Month. But I can't have both of you here without acknowledging that October is Breast Cancer Awareness Month. And you just mentioned breast cancer. And I know, Sheelagh, you work very closely with breast cancer patients and the program at Union Hospital. So talk a little bit about those screenings and the importance of mammograms.
Yeah, sure. So I have, been the manager of the breast center for 6 years, and I truly do see the benefit of mammography. We recommend mammograms for people that are average risk, starting at age 40. Now, if you have a higher risk because you may have factors such as a family history or other, risks, and certainly the thing that we are finding about cancer is it's certainly more personalized. So it's always worth, having those discussions and speaking with your primary care provider, and they can guide you with that. But we are sharing resources afterwards. I know that we'll, give more information about that. But really, if you have regular screening, then we do pick up, things early, and we can identify what might look different. And I see each and every day through the breast center patients that we are able to compare their mammograms and then identify maybe there's something looking different. And even if it is something, it is an early cancer, then we can treat it so much easier than somebody that turns up in a very late stage. So I'm a huge advocate for encouraging women, and we do have some men, but that's not not necessarily typically having screening for men. But to come and get regular screening, make an appointment with your girlfriend to come and get your mammogram, and go for lunch, treat yourself. Women so often do not take care of themselves. They take care of everybody else, but this is the time to take care of you. It doesn't have to be in October, make it your birthday month, whatever you need to do, because I see each and every day we have women that are diagnosed with breast cancer. And if it's an early case, it's so easy to be treated. And we have our survivors that come in year after year. They do their mammogram, we celebrate them, carrying on. So you can tell it's my passion because I see it. But yeah, absolutely. And I do want to add my little add piece. In Maryland, you do not have to have an order from your doctor if you're not having any issues. You can actually do a self-referral. I always advocate that you do see your doctor regularly because they're, great to discuss, all things about your health. But it is something that if it's that barrier for you getting it done, you can do a self-referral. Okay.
Thank you. That's such an important point for people to understand. And Dr. Hasan, you mentioned that breast cancer and lung cancer make up such a large number of cancers, but there obviously are many other cancers that we aren't really diving into today, but there are screenings for. So touch on what people should also be keeping in mind other than lung cancer and breast cancer.
So other common cancers that you can get screening for. So first, a regular physical examination by your doctor, your skin examination, catching your sunscreen. Prevention always comes first. So, using sunscreen for skin cancers, and then just having an examination, catching those skin cancers early, especially the melanoma. And pap smear for women at their gynecological appointments, and the colon cancer screening by colonoscopy, which starts at age 50 or earlier in case of high-risk patients. So these are the more commonly screened cancers that we need to go for and talk to our family doctors.
And you mentioned it starts with prevention. Let's go back to lung cancer for a minute. Other than not smoking, what can people be doing to lessen their risk for lung cancer?
So I guess the largest reduction in lung cancer or lung-related, a lot of people do not know that smoking actually causes a lot of other cancers as well. For example, bladder cancer, it increases the risk of a lot of other cancers. So the largest reduction in mortality for most cancers, a lot of cancers will come from smoking cessation. Staying healthy, eating healthy. We know that a lot of cancers could be related to the type of food we eat. So make the right choices for your health, environment, and prevention, especially the smoking cessation. I think these are all the important things you can do to prevent cancer. And especially if you have family history, definitely mention it to your doctors, because family histories do make you at a higher risk for certain cancers. Even if you're not a high risk from smoking, we know that about 15% of the patients who have lung cancer may never smoked in their life. So it certainly has to be this overall health lifestyle, despite if you're not smoking.
And if someone watching is thinking, I'm behind on my mammogram, or I might have a risk for lung cancer, or I should get many of the other screenings that are out there, how can they go about doing that?
They can go ahead and now for lung cancer, for the lung cancer screening, they do need to make an appointment with their primary care provider, because we do need to get the order, and there is a conversation that needs to be had with the primary care physician. I know that Dr. Hasan spoke to at the beginning of our conversation, so that needs to be occur. Make an appointment with your primary care physician first, and then once they've had that conversation, in that conversation they will also have that conversation about smoking cessation. And I do want to do a big call out to the Cecil County Health Department. They have great resources. We could not have a conversation today here about lung cancer without talking about smoking cessation. So if anybody's listening and they're wondering, are there any resources? Yes, the Cecil County Health Department is fantastic. And then I mentioned for mammogram, again, you can actually just call the ChristianaCare Union Hospital Breast Health Center. And, if you are not having any issues, like any lumps or rashes or any discharge, then you can, as I say, do a self-referral. Now for colonoscopy screening, many insurers now will actually do them as early as 45, because we are seeing earlier cancers in some of our population. And again, you do need to get an order to be referred for colonoscopy, or the alternative, which is the fecal DNA testing. And again, that's a discussion with your primary care. So many of these, make an appointment. And if you're having symptoms, you need to let that person know when you're calling. Don't just say, oh, I need an appointment. If you have that conversation with the person on the phone, if it's a concern, they're going to get you in earlier. But, having that conversation with a primary care provider is going to be your portal towards getting screened.
And if someone is uninsured or underinsured and isn't sure if the screenings would be covered, what should they do?
So again, I'm going to give a huge call out to the Cecil County Health Department. I'm going to give you a number. It's 410-996-5168. They have some great nurse navigators over there. There are some programs that are specifically provided to you as a Maryland resident that are to facilitate you being able to get screened if you do not have insurance or if your insurance is insufficient. Because, certainly we want to be able to get everybody screened and to have early detection and early treatment if appropriate.
Absolutely. And Dr. Hasan, I'll give you the final word before we wrap up. What is the biggest takeaway you want our viewers to understand today?
I would like to repeat, Megan, that the largest reduction will still come from smoking cessation, but as I mentioned before, former smokers can also have lung cancer, so definitely talk to your doctors about it, get vaccinated, and be open to your about your questions, and talk to your family doctor about any questions.
Absolutely. Well, thank you both so much for your time and all of that information today. And if you are watching after this live ends and have other follow-up questions, please continue to submit those questions in the comments, and we will be able to get to your question and answer it in the comments after this live is over. Thank you so much and have a great afternoon.